Now we will discuss acquired glaucomas. Okay, previously we discussed congenital glaucoma, primary infantile glaucoma. Now we will discuss acquired glaucomas. The first one is primary glaucomas. So what is primary glaucoma? Primary glaucoma means that the intraocular pressure it is increased, the IUP is elevated. Okay, IUP is elevated without any secondary cause. But the problem is within trabecular meshwork itself. Okay, there is the problem in the trabecular meshwork itself. There is no other secondary cause. This is called primary glaucoma. We have types of the primary glaucoma. We have primary open-angle glaucoma, means the angle is open. Okay, there is no occlusion of the angle. And we have the primary angle closure glaucoma, in which this angle will close. Okay, it will close up. So now we will only focus on the primary open-angle glaucoma with in details with pathogenesis, clinical features, diagnosis and treatment. So primary open-angle glaucoma, it is the bilateral optic neuropathy characterized by the following features. Okay, we have 5 features which specify that it is the primary open-angle glaucoma. These are that the bilateral, this is the optic neuropathy, the optic nerve disorder, and has 5 characters. Okay, the IOP will be more than 21 millimeter of mercury. Okay, the intraocular pressure is more than 21 millimeter of mercury. We will have optic disc changes. Okay, there will be specific characteristic changes in the optic disc, and with associated visual field defects will be there. Okay, and the fourth one is that when we analyze this angle with gonioscopy, it will be normal, it will be open angle. Okay, and the last one is that there will be no other secondary cause of glaucoma. Okay, so characterized by increased IOP, optic disc changes, visual field defects, normal angle and no other secondary cause of glaucoma. This is called primary open angle glaucoma. Etiology and epidemiology. Remember, it is the most common type of glaucoma, and it is out of every 200 individuals, 3 people are involved over 40 years of age. Okay, so most common, and over 3 people are involved. The other etiological factors that which can cause primary open-angle glaucomas, this can be remembered by a mnemonic called HER-FMDC. I have met this mnemonic, guys. So HER-FMDC. In these etiological factors, the primary open-angle glaucoma can be present. For example, hereditary. This glaucoma can be present hereditary, and it is polygenic in nature. Age, it is common in older people. Race, it is common in black people. In retinal disease, the second R is represent the retinal diseases, retinitis pigmentosa and central retinal vein occlusion. Okay, so in these retinal disorders, the primary open-angle glaucoma can be present. And remember, FMDC, family history is important. The first degree relative can be involved. And in myopic and diabetic patient, primary open-angle glaucoma can be prevalent. Okay, and the last is the frequent and high dose of contraceptive pills. Okay, when women they are taking frequent contraceptive pills in high doses, it can cause primary open-angle glaucoma. And remember, the last one and is the most important for you people is that steroids. Prolonged use of topical steroids and systemic steroids can cause primary open-angle glaucoma. Okay, so how this etiological factor can cause primary open-angle glaucoma? What is the pathogenesis? The pathogenesis is that as this is the angle. Okay, so the angle I have zoom it. So these are the trabecular meshwork layers. Okay, we have the uveal layer, corneoscleral layer and juxta canalicular layer. Okay, so what will happen due to these etiological factors, the cells, the trabeculocytes which surrounded these which surrounds these perforations and these pores, okay, these cells, they will last. These cells will be lost. Because of these etiological factors, these cells will degenerate and last. When these cells are lost, degenerated, then these spaces will be replaced by the deposition of extracellular matrix. Extracellular matrix will be deposited in these intracellular spaces, okay? Extracellular matrix will be deposited because of the dropout of the trabeculocytes. The cells which surround this trabecular meshwork, they are called trabeculocytes or goniocytes. And plus, the deposition of extracellular matrix will be followed by the absorption of a lot of water. So, the deposition of extracellular matrix and the absorption of water, these spaces, they will close up. Okay? These spaces in the trabecular meshwork, they will close up. When what will happen? It will derange. It will derange the outflow of the aqueous humor. And it results in increased intraocular pressure. Okay? So IOP will be increased. This is the pathogenesis because of these multiple etiologies in primary open-angle glaucoma. Now, how the patient will present to us? What are the clinical features? The patient will present to us with night blindness, delayed dark adaptation, it will be delayed, and there will be a painless sudden visual loss. And this visual loss can be complete visual loss in one eye and severely deteriorated in another eye. Okay, and when we look through gonioscopy, perimetry, and fundoscopy, there will be the IOP will be more than 21 millimeter of mercury. Through fundoscopy, there will be optic disc changes. Okay, there will be optic cupping and characteristics optic disc changes. And through perimetry, we will have visual field defects. Okay, and remember, as when we analyze this angle will be open and normal appearing. As this is primary open-angle glaucoma, so we will have normal and open angle. And the last, an important one is that there will be no other cause of secondary cause of glaucoma. Okay. So night blindness, sudden and painless visual loss, IOP is more. We have optic disc changes, visual field defects, and normal appearing angle, and no other cause of increased intraocular pressure. These are the clinical features. So now the diagnosis and treatment, they needs explanation, so it will be discussed in another lecture. Thanks for watching the video.